You to join them.
Talking to Dr. Faulkner from Haney Medical College, and we're dealing with diabetes and kidney disease. One of the real issues dealing with kidney disease and diabetes, Dr. Faulkner, as you probably know, is the whole issue of weight control. Let's talk about that as an issue that you face dealing with some of your patients.
Well, of course, when you talk about prevention of diabetes, obesity is very much related to, and probably the #1 cause of diabetes mellitus in the United States of America. As you know, we overeat, we supersize, and that has been a tremendous problem that we see as a big cause for diabetes. Now, as we look at diabetes occurring in childhood now, you know, it used to be what they used to call the juvenile diabetes or the insulin-dependent diabetic. Now we're finding children with the adult type of diabetes starting very early in life, and those children are extremely obese. So if we wanted to prevent diabetes, which cost about $92 billion in 2002, if we want to cut that cost, if we want to control diabetes, we can start out early with diet and exercise. And of course, you know, they had cut a lot of the exercise out in the schools, and people don't walk, and people drive everywhere, including myself. If we go back to exercise, walking, I think that we can, and stop supersizing, then I think that we can grab some type of hold on the weight control and prevent a lot of diabetes.
Just a little prevention in terms, if you're talking about something that costs $92 billion, if you're talking about a very little prevention, ought to be able to deal with that as an issue. You know.
And see, that covers all of diabetes. That's all the home health visits, the hospital visits, the amputations that you get from diabetes, because diabetes is the #1 cause for non-traumatic. That means not an accident causing a amputation, but just non-traumatic amputations. Diabetes is #1 cause. Big cost in diabetic eye disease, with diabetic retinopathy, blindness from diabetes. So we can prevent a lot of problems that we have. Heart disease, heart attacks. A lot of patients with diabetes have coronary artery disease. So we can prevent diabetes, we can curb a lot of the costs that's related to diabetic care.
And this would include medicine, hospitals, and the whole thing, just the whole medical bill that we have to pay as a nation. That we can really deal with that.
Exactly.
Well, it seems to me, well, do you believe that we are as actively engaged as a nation in trying to deal with prevention rather than simply to wait on something to happen?
I think that we are. I think that a lot of people do understand that we need to cut back. A lot of states have weight control programs, and we're working desperately trying to educate patients when they come into the clinics to see us, especially at Metropolitan Nashville General Hospital and the clinics of Haney Medical College. We even implemented a program in family medicine at Haney, where we implement all of the diabetic indicators in the electronic medical record to make sure that we don't miss any patient that comes in, look for those indicators that might end up in organ damage.
And so there's a real push on in reference to try to deal with this as a disease to prevent diabetes.
To prevent diabetes and to control the diabetes if you already have it. And to look for any organ that might be exposed to trauma from diabetes.
When you talk about organs exposed to trauma from diabetes, what are we saying?
We're talking about brain. We don't want you to end up with a stroke. So we don't want you to have a high cholesterol, which could cause you to end up having a stroke, heart attack, or peripheral vascular disease, where you would end up having to have amputations, or kidney disease, which you would end up on dialysis, or eye disease for blindness. So we try to get you seen by the specialists that you need to be seen by, and to monitor your blood sugar during the primary care clinics and monitor your organs as well.
Well, now, have we